Hi everyone, welcome back to the channel. This is going to be part 2 of Docturdle, or Doctordle. I don't know which one it is. Um, so we're going to go through these and see. I'm not sure if they put these back in order from the last video. So these might be repeats. If they are, I will try to skip them. So the first one is a 32-year-old woman presents with severe mood symptoms that she and her partner have noticed follow a reliable monthly pattern. I don't remember if we did this in the last video. Reliable monthly pattern. We did do this one. So I'm going to skip this one. No, we didn't do this one, but I know what it is now that I read this. We did not do this one.
Are you serious right now, bro?
That's my fault. I don't know why they can't just put them in order from the last time. That would be great, but okay. Let's see. A 26-year-old woman reports 5 days of unusually elevated mood, decreased need for sleep, and rapid speech. So only 5 days worth. I'm not gonna go straight to bipolar disorder. And it also doesn't sound like a full-blown mania. So I'm gonna say hypomanic episode. Yeah. I did that because a lot of the times with full-blown mania, you'll see gambling, spending a lot of money, not really knowing it happened, regretting it afterwards when you mood shift. So, okay. A 34-year-old woman presents with a persistent low mood that has been present nearly every day for the past 7 weeks. I'm going to go straight to dysthymia. Again, I don't remember if we did this one already, but based on just a persistent low mood nearly every day for the past 7 weeks, it is incorrect. Okay. She reports profound fatigue, difficulty concentrating at work, and a loss of interest in hobbies she previously enjoyed. Is it major depressive disorder? Wow, okay. First one just kind of caught me off guard because persistent, I was thinking like maybe a persistent low mood, but no, this was full major depressive disorder. And sometimes it can present as dysthymia, it can build up, and that may have been what happened there. But what was the time frame again? Wasn't it weeks? Yeah, that makes okay. A 19-year-old man presents requesting rhinoplasty, which 2 surgeons have declined to perform because they see no abnormality. So basically, this is a 19-year-old that is requesting a rhinoplasty, the cosmetic surgery, which 2 surgeons have declined previously. So this is number 3 surgeon, because I see no abnormality. So I'm going to go body dysmorphic disorder. I'm assuming this may not be the first time plastic surgery has come up, but is also very common in this age range. Yeah. A 28-year-old woman presents after cutting her forearms, which she reports she did to feel something when emotionally numb. I'm going to try major depressive disorder. I don't know if that's what it is. It's the emotionally numb part that's kind of getting me away from this, but we're going to try it. She describes a lifelong pattern of intense relationships that rapidly alternate between idealizing the other person and feeling completely let down by them. Is it borderline? It might be borderline. Yeah. It really was the kind of emptiness feeling that kind of gave it away. A 29-year-old woman presents with excessive worry that she describes as difficult to control and present on most days over 6 months. I'm going to go straight for generalized anxiety disorder. I don't know for sure that's what it is, but that's going to be my first guess just based on excessive worry, most days, over 6 months. That's going to be my first guess. Yeah. A 38-year-old man presents 6 weeks after being made redundant with low mood, poor sleep, and an inability to motivate himself. Let's try major depressive disorder, but it also could be an adjustment disorder. Yeah, I'm going to go with adjustment disorder. Just based on the fact there's no prior psychiatric history, generally resilient, and then after being made redundant with low mood, poor sleep, inability to motivate himself. I think it's going to be an adjustment disorder. A 28-year-old woman has a 5-year history of psychotic episodes and periods of severe depressed mood requiring hospitalization. 5-year history. So here's the key points. 28 years old. 5-year history, so that would have been at 23 that maybe this started. Psychotic episodes and periods of severe depressed mood requiring hospitalization. Could it be depressed? They don't have anything on here for psychosis or like depression with psychotic features, so I'm not exactly sure what this could be, because it seems like a combination of psychosis or psychotic episodes, acute psychosis with severe depressed mood. It's like major depressive disorder. So I'm assuming that she's unable to get a diagnosis of either major depressive disorder or schizophrenia, and maybe it's something in between. I don't know. Oh, you know what? It might be schizoaffective. Yeah, no. After I didn't understand that when I was reading it, but then when I was reading it back to myself or telling you what I was reading, then speaking it out loud kind of gave it away. So I was like, something in the middle. That's exactly it. A 36-year-old woman has not left her house unaccompanied for over a year following a fainting episode on the underground. I'm going to go straight for agoraphobia. Yep. Just for the fact, not leaving the house, unaccompanied for over a year, so this is a long term now, following a fainting episode on the underground, so. A 30-year-old man presents requesting help. I think we did this one, so I'm just going to skip it. Because I know it's specific phobia, so. A 24-year-old woman has multiple depressive episodes with anhedonia, low energy, and suicidal thoughts. So, the key word here is going to be multiple. So, this doesn't seem to be like an ongoing, daily, all the time depression. I don't think it's going to be major depressive disorder. I don't think it's going to be seasonal affective disorder. I don't think it's going to be... I mean, is it dysthymia? No. Between depressive phases, she has periods of elevated mood with decreased sleep and impulsive behavior. See, they didn't give us much on this first one. They did not give us much at all. Now we're seeing that this is more of a sometimes depressive, sometimes looks like maybe hypomanic, but maybe full mania based on whatever the impulsive behavior actually is. So this is definitely not going to be a hypomanic episode for being multiple swings. I'm going to go for bipolar 2 first. Oh, wait. What did I do? I hit a button, and I don't know how to unbutton the button. So we're putting a... No, how do I get rid of the stickers? There we go. I don't know where those came from. So we're going to look at a sticker here, unless it doesn't even show up on the screen. Let's go with bipolar 2. It is bipolar 2. Okay. The next one was going to be bipolar 1, so it's bipolar 2. A 23-year-old graduate student presents with extreme distress whenever she has to speak in seminars or meet new people. Let's go social anxiety disorder. Yeah, okay. A 17-year-old girl is referred by her GP with a BMI of 15.2 after significant weight loss over 6 to 8 months. Based on the low BMI, the short duration that this happened in, of course, I don't know what the starting weight was, and being referred by a general practitioner is highly indicated of anorexia, so I'm going to go with that first. Yeah. And blood tests show hypokalemia, so low blood potassium, and elevated liver enzymes consistent with starvation, visibly underweight. She insists she feels fat and describes a persistent, intense fear of gaining any weight. Yeah, that's correct answer. A 41-year-old accountant is preoccupied with lists, schedules, and perfect order. So just based on this, especially perfect order, I'm going to go straight for obsessive compulsive disorder. That is not right. Okay. He spends so much time trying to make work flawless that deadlines are missed. This sounds like an obsessive compulsive disorder. Do they have just obsessive? Obsessive compulsive personality disorder? I'm not familiar with that. But let's try it. No, it is right. Okay. I'll have to look this up later because I actually don't know much about. I know about OCD. I don't know much about it as a personality disorder, so that's something I need to research. A 42-year-old man is brought to the emergency department with slurred speech and ataxia. So when I think of this, I'm thinking of medications, drugs. There's a few that come to mind: benzodiazepines, barbiturates, some antihistamines, even opioids. We haven't gotten to pinpoint pupils yet, and of course alcohol. So I'm gonna see what's on here and what I can put. I don't think, opioid intoxication is not on there. Benzodiazepine intoxication is not on there. They're not gonna have that. What was the other one I said? Antihistamine, Benadryl, nope. So, do they have alcohol intoxication? Okay, so it must be alcohol intoxication. Let's go to the next one. A 26-year-old man presents after a series of sudden, overwhelming episodes of intense fear that peak within minutes. So, there's sudden onset, overwhelming episodes of intense fear that peak within minutes. So that's leaning me toward panic disorder instead of a phobia, because it doesn't seem like there's any type of stimulus that would be provoking a phobia, because it says it's sudden onset. Seems like there's no rhyme or reason for it, so let's go panic disorder. Yep. A 10-year-old boy has repeated blinking and throat clearing that worsen with stress. Okay, keywords here are going to be worsen with stress. Well, it's not really a word. That's a sentence. Need to learn. Repeated blinking. So sometimes when I think repeated blinking, I do think sometimes like focal seizures, but they can also be signs of Tourette's or some type of tic disorder, especially in 10-year-old. Throat clearing, repeated, that worsens with stress. So I'm going to go with Tourette. No, they do not have it. They have tic disorder? They do. Tic disorder, that is correct. A 25-year-old woman presents 4 days after witnessing a fatal road traffic accident in which a pedestrian was struck directly in front of her. So, some keywords here are going to be 4 days after witnessing a fatal road traffic accident, and the pedestrian was struck directly in front of her. So that's going to give us an idea that this is some type of trauma. Due to the fact that it's only 4 days after, I'm not going to put in post-traumatic stress disorder, but I will call this acute stress disorder if I could type. A 44-year-old woman presents with difficulty initiated in maintaining sleep that has been present on most nights for 8 months. So, I'm going to go straight to insomnia. They have it, insomnia disorder, okay? And that would be correct. A 28-year-old man is brought to the emergency department after using methamphetamine. So, what would I call it? Stimulant overdose? No. No. Amphetamine. That's weird that they put it like that, but I guess not. But I also feel like, because you'd probably also have the patient have acute paranoia as well, acute psychosis due to the amount of methamphetamine. With any stimulant, the higher the dose, the higher the risk of acute psychosis or delusions, especially with lack of sleep, because a lot of people that use them overnight and they're up for days, and that can lead to psychosis and delusions. Because you can see here, he's agitated, paranoid, and visual hallucinations, so that would be potentially an acute psychosis. A 6-year-old boy adopted at age 4 from institutional care is referred for behavior assessment. So this doesn't tell me much. All I can get from this is the 6-year-old boy was adopted at age 4 from institutional care. So I'm thinking some type of attachment disorder. I don't know if they're going to have that. Reactive attachment, they do have it. A 38-year-old man presents requesting a full-body MRI scan for the 3rd time in 6 months. So my guess, I think we saw illness anxiety on here. That's my first guess. Because requesting a full-body scan for the 3rd time in 6 months, that's basically every 2 months you're trying to get a full-body scan. 1, I doubt insurance is covering that. 2, it's just, in most cases, unnecessary. So let's go with illness, anxiety disorder, and see what happens. Okay, that is what it is. Yeah. Alright, so we're going to end here, and we're going to do a part 3 coming soon. Comment below if you want a part 3, and I will be replying and liking every comment. If you could like and subscribe, I would appreciate it. I appreciate you all watching.